Welcome, Fundis, to another installment of Funda Chat. We're busy with Funda Care and the Cerebral Palsy Rehabilitation series. Today we've got Nicci Jansen Van Rensburg with us. She's a speech therapist and an audiologist, and she's got 20 years experience in both. And they're two separate qualifications for those that don't know. And we're going to chat a little bit about that today, and about the cerebral palsy rehabilitation and her role in it. Welcome, Nicci.
Thank you. Thank you for having me here. It's an honor.
It's a pleasure. So, Nicci, just enlighten us a little bit. What's the difference between a speech therapist and an audiologist? Because I believe in the past we used to speak about a speech and hearing therapist, but now it's not like that. They're two separate segments of the market, so to speak.
So, a speech therapist works on any area of communication deficits from baby right through to the geriatric population. Whereas an audiologist works with hearing, tests for hearing loss, auditory perceptual abilities, and the rehabilitation thereof.
Okay, perfect. And with your treatment of CP kids, something that I read that you do is NDT. What does that stand for, and what does that mean in terms of the speech qualification, I suppose?
That is a separate qualification that you do postgraduate, neurodevelopmental therapy. And in that training, it is a combination of speech therapists, occupational therapists, and physiotherapists combined, doing training on specifically cerebral palsy and how it affects the body and how to use specific techniques in rehabilitation.
Okay, perfect.
It goes further where you do advanced speech therapy, oral rehabilitation for speech therapy, and the physios and the OTs also have their advanced courses.
Okay. Then in terms of the CP rehabilitation, you're using the speech therapy more prominently. We'll get to the audiology a little bit later, but in terms of the speech therapy, what does that entail? Because obviously this person, depending on how much damage they have, sometimes they almost like locked in syndrome. They can't communicate, or they struggle to communicate. How does your therapy, or how do you get started with somebody with CP?
I think in all cases, we start with trying to determine what the child, mostly, can understand. What is their level of understanding of communication, so that you can work on their level and build that up.
Okay.
It's very difficult to assess what they can understand. I always start with play. If it's a little boy, I take a car and a car track, and we see if he has the understanding that this is a representative of a car and that he can play and use his imagination. For a little girl, I may give a doll and a ball and a towel and see whether she will try to feed the baby, care for the baby. And then we go into formal assessment where we use formal tools to really try and measure what they understand.
Okay. And what tools are involved? Because some of them can't, for example, move their hands and things. And I mean, my son's been with you for an assessment, and he was pressing a button to show you he can hear whatever he's hearing. So how do you deal with the CP claimant that can't really move in the same manner?
So over the years, you adapt some of your formal assessments. When we evaluate receptive language, what we understand, we will often have three pictures that we present to a child. There may be a man, a man, a fish, and a dog. Show me the dog. So what we will do in the case of a child with cerebral palsy, over the years I have copied those pictures, enlarged them, laminated them, and I may hold them up separately and request the child to look at the relevant picture so that I can see whether they understand that particular word. And it builds up into level of difficulty to reach their plateau where they no longer understand the words.
Okay, that makes sense. And then in terms of your therapy here at FundaMedical, how have you found that different to doing it in private practice?
I started working in the public sector, and that took me back to where we could easily get the team together, physio, OT, and speech therapist in one room with a child, and all of us perform our functions simultaneously. In private practice, it's not so easy to get everybody together in the same venue at the same time, but we do have multidisciplinary team therapy sessions. Not as much as we would like, but we try and achieve that.
Okay. And with the family, how do you find interacting with the family? Because they're obviously an important component of the therapy side of things. So how was your experience with the families?
I wonder if that's not the most important factor. In the end, if you deal with a child who is truly low functioning and cannot do much, how do you help that family? By helping the caregiver. I don't think we really understand the caregiver burden. It's a never-ending task from morning to evening. And for them to derive joy in their day-to-day living, for their day-to-day living to be, to ease the burden of that day-to-day caring and to get some fun back into life.
That makes sense. And I think with them, they've sort of adapted and learned specific things out of necessity. And where at least with yourself and your colleagues, you've learned it through education and experience. So I think for them, it's also very advantageous to have a multidisciplinary team at the ready in a way as well.
Can I add to that?
Yes.
I think so often parents and caregivers love that child so much that they anticipate the need so much that they don't request any communication from the child. They don't actively facilitate communication because they know by this time the child will be hungry and by this time there may be a nappy, and they just care. And then sometimes they don't no longer communicate, which is truly sad.
That actually does make sense. But I think that also helps you as the therapist, because they are able to communicate at least. So they can convey certain things to you, like if they're seeing a specific twitch or something, a reaction to something, then they almost become the interpreter for that child as well.
They definitely become the advocate for their own child. And by them knowing that child and you taking a good case history and really making sure that you understand that family's needs, you can cause or be the facilitator for life quality, more life quality.
In terms of life quality, one of the things that you deal with is assisting in swallowing, as I understand it. How does that work?
So the diagnostic term for anybody who struggles to feed is dysphagia, and dysphagia can be extremely dangerous. And I think when considering a child with cerebral palsy and the poor movement, if you find it difficult to control your hands and feet, it's much more difficult to control smaller muscles like your lips and your tongue and your cheeks. And to safely eat, you need to take the food into your mouth, create a little create a little bolus, and swallow that bolus safely. Clear your whole mouth and take your next bite. Often these kids also don't have good sensation, so we don't realize that there's a piece of bread stuck in the mouth. Or they've adapted poor patterns like throwing their head back and swallowing like this, very often with an open mouth. And that is very dangerous and can cause aspiration, lung infections, which may lead to death.
Okay. Now we go on to the topic of hearing from the audiologist's perspective. How difficult is it to determine hearing loss in a CP child?
It really depends on the function of that child. Whether they have one hand that has more control, whether they can raise a hand to tell me that they've heard a sound, whether they can repeat some words after me. But we do have objective testings where the child does not have to respond, just relax, and we take measurements. I think the safest option in the young child or the child with cognitive delays would be to refer for auditory brainstem response. If they are calm, they don't have to be sedated, and they must just lie there. A sound is presented into the ear. If there's a sound wave and the matching brain wave, then the sound was perceived. If the sound is there and there's no brain wave, then the sound was not perceived. And you raise the volume and you try again until you can determine the thresholds of that patient. That makes testing much more expensive, unfortunately. But that is probably the most accurate way of determining hearing.
Okay. That makes sense, and yeah, it sounds like it can be quite onerous for the child and the parent.
That's why they often sedate a child, so that they just sleep during the testing. This is not full anesthetic, just calms them enough. But it is administered by a doctor. It has to be in a hospital setting. There has to be oxygen available. There are a few prescribed prerequisites to do that safely.
Okay. And then, in closing, are you involved in any adaptive or tools that you provide the CP child?
Oh yes, I think that is the most exciting part of the rehabilitation. So if a child can cognitively understand that picture on the paper represents a cup, and point to the cup when he's hungry or when he's thirsty, or point to a plate, a picture of a plate. So we develop what we call a core communication board, where they can point or look. We can use their feet, if they've got control over their feet, to tap or point or gaze or look. These can become very complex communicative systems. There are kids that can use a tablet with ease and go into different of these components if they have the cognitive skills. If not, you can set up basic pictures by presenting a picture of the juice versus the milk. And we sometimes just start by holding the juice and the milk so that they can make a selection, because it's very sad that some of these children have control over nothing in their life. They are given milk. They are given juice. And sometimes we just have to start by giving them little choices where they can indicate what they would like at that point in time.
That makes sense. Thank you so much, Nicci, for being with us today. Really appreciate it. Folks, thank you for joining us. Please like, subscribe, and share this video content, and please comment. We'd like to know if you've got any questions for Nicci or the rest of the team. Let us know in the comments, and we'll happily communicate that and get you answered. Thank you so much.